in these next 3 weeks, basically. You'll have 2 lecture quizzes. You'll have 1 lab quiz, 1 practical, and 1 test. Now, I really want to look at the practical, and I don't have any answers right now. I don't have the magic answer, but I'm throwing it out so that we can come up with an answer. Not today, but because I got a lot to talk about. But we need to kind of think about it, and that is pelvic traction takes a while to do, as far as practical wise. And when you're trying to do 13 people in one lab and 6 people in another lab, we can go over, and I don't really want to go over. On the other hand, since you have some familiarity with traction, it's just cervical, not pelvic, it shouldn't take that much to learn it. All right? So I want us to start thinking after this week about an interest in doing an early practical. So if you're interested in doing an early practical after this week, let's see if we can get that in. So at worst, for the pelvic traction practical day, we won't have that many. It would be nice if we won't have any during that time frame. The other thing we need to consider is test 3. And this test is not as long as the others in the past. However, it can push us more in the afternoon. And I don't want to do that. So I've spoken to Nod. Again, we don't have all the great answers yet. But if we can get these practicals done, especially the Wednesday lab, then hopefully we can do the test first on that Wednesday. And then you can go to Nod's class afterwards. But that's just a thought and what we're thinking about. So really pay attention, especially to pelvic traction today, because I'll talk about it, we'll demonstrate it, show how it's done, and start getting a mindset of if you can do it early, because that's what we really want to do, is get it done early. All right, you will get on, week 12, you'll get a new book on April the 15th. All right, and we will, no, you'll probably get it before then. No, yeah, you'll get it on April the 15th. So we'll do 1 lecture out of book number 4 on the 15th of April. And then we'll still be in book number 3 for the pelvic traction practical, if we're not done by that time. And then, of course, we'll do test number 3. But then after that, we'll stay in book number 4. So week 12, 4:15, we'll go with a new book and just do 1 lecture out of that new book. And then we'll finish up with book number 3 for the test. All right. Just an encouragement. But keep in mind you don't have much time for your PowerPoint presentations. I don't know where you are on that. But keep in mind that you only have a short period of time as a group. I've seen a group get up here and talk, or downstairs, wherever we tend to be. And one person would talk 8 minutes. It's too long if it's 4 people. So you need to find a way to break it out so each person has an opportunity to have some sort of equal time. But in order for that to happen, you really need to spend time together early so it happens. Remember, success is on purpose. It's not going to just all of a sudden happen. You have to practice that several times for that to happen. So make sure you do that. All right. Test 4 is pelvic traction practical. So we'll talk about these today, but I just want to make sure that we are familiar with where they are in the book, because I know people start using techniques as to how they're going to learn a chart or grid of information, and so that you'll know where it is. So I'm going to start with some lecture information. Now I want to start, rather than going to iontophoresis first, I want to do biofeedback first, which starts on page 7. So we'll go back to the early ionto. But it's more easier to do biofeedback first than to do iontophoresis second. All right, so let's say that a doctor took your blood pressure, and when he took your blood pressure, he was pumping, and then he let it out, let the air out, and you saw his eyes say, his eyes got big. All right. Now you're sitting there like, no big deal. All right. But you see his eyes get big. All right. So you say, well, sir, what's wrong? Your blood pressure is really up. So he turns the screen around so that you can see it, and you say, and your eyes get big too. All right. What happened? Feedback. Insight. I give you a micrograde, and you look at the top and it says 72.3, and you say, what was that? Feedback. Insight. So, in the blood pressure mindset, what do you need to do to make that better? Eat right, get rest, stay away from stressful conditions, exercise, etc. All right? That's what you do to rectify it. In this grade situation, what do you do? Ms. Nard, look, Mr. Chandler, I need help. What do you suggest that I do? Etc., etc., etc. And then try to fix it from there. Cut back maybe some work hours, cut back some time spending with friends and family. Do whatever you need to do to fix the situation. Well, biofeedback is the same thing. You know, you walk up to a mirror, you have your tie on, and you don't know until you, oh, my tie's crooked. So you fix it. But you don't know until the feedback comes. All right, so biofeedback is a feedback loop. So it's a way of getting feedback to the person. It's a way of getting feedback to the person. Physiological change is detected and measured by a device. Detected and measured by a device. Now, what things can be measured from a biofeedback machine? Muscle activity. All right, muscle activity can be measured. Heart rate could be measured. Respiratory rate could be measured. Blood pressure could be measured. And skin temperature could be measured. Now those are the specifics. Globally, we're either looking at contraction or stress. So, a muscle contraction or stress. That's usually what it's used for. So, usually if your skin temperature goes up, if your heart rate goes up, if your respiratory rate goes up, your blood pressure goes up, in some cases we're dealing with a stressful condition. If you have a big muscle reaction on the screen of a biofeedback machine, that means you're doing pretty well. If you don't have that much feedback showing on the screen, that means that we need to do something to improve. Okay? So, output is measured and displayed visually and audibly. Now, visually, on a screen, you'll see a graph or a bar graph. And as the person moves, it'll go up and come back down. They contract, it goes up, come back down. They contract a little bit, it goes up. They contract a lot, it goes up. So depending on what the person does. But also audibly too. So, if the person moves a little bit, you might hear, If they move a lot, you might hear, So it might get louder. Okay, so depending on the movement, that's going to be the feedback. So if the person hears a big sound, they're thinking that I'm doing pretty well. If they don't hear a great sound, then they're thinking, I need to improve. Okay. Now, subject perceives this information. And now, what's happening? They have been made aware of what's going on. Again, I give you that micrograde, you say, you've been made aware. Now, all of a sudden, you want to start making personal changes in order to improve. All right, so the feedback gives you some sort of insight to see if you can improve. Via unknown neural pathways, subject makes conscious attempts to alter. Now you want to try to fix it, all right? Physiological change is affected as a result. Okay? Encourages voluntary repetitions of a reaction. So, if I see on the screen movement like this here, all of a sudden I'm thinking, I need to do better than that, so I'm going to try harder. It's going to encourage me to do better because I can see something. I have a goal for it. Informed patient when correct response is made. Biofeedback unit is capable of picking up small motor activity and quantifying it, showing exactly numerically on the screen where they're doing, where they are and what they're doing. So, uses of the machine. Sets out to teach the patient control of their own body with long-term benefits. Should be, here's the key word, integrated with other treatment, not independent. What does that mean?
You should be doing more than just that.
I should be, because biofeedback is doing nothing. You know, if I take the blood pressure, and I keep taking the blood pressure, and I keep taking the blood pressure, and I keep taking the blood pressure, is it going to go down? No. But if I take the blood pressure, and I eat right, I take the blood pressure, and I exercise, I take the blood pressure and stay out of those stressful conditions, then I can keep going back to that blood pressure device and seeing some sort of change. So if we're dealing with some sort of muscular activity, if I see where the movement happens, then when I get away from the machine, I need to do what? Get some weights, do some sort of exercise program, go back to the machine, and then see if some changes happen. All right, so we're not going to do it by itself. Control of muscle activity and movement. Now, EMG stands for electromyograph. All right, so here is an electromyograph. And on the screen of the electromyograph, I can see the activity on the screen. Okay? All right, so surface electrodes. Surface electrode. I'm just going to give you, I need these back. Is that 3? Good. So, surface electrodes detect electrical potential of firing motor units. All right? Now, to minimize the interference of the activity not being able to give the best results. All right? To minimize that activity, we're going to use silver chloride electrode. So, this metal is referred to as silver chloride. Okay, so we're going to use these electrodes because the studies have shown that really picks up even the smallest of movement of activity. And then we're going to clean the skin with some alcohol very well. Make sure there's nothing, no dirt on the skin. Nothing is going to impede any activity that's going to come through. All right. Then use a pumice stone. What do most people use this for? Feet, calluses. So I want to use this on the area that I'm going to treat to make sure that that skin in the area is really ready to give me as much as possible. All right, so I'm going to scrape it really, really good. Make sure you don't make it bleed. Or you can use an emery board. Now, why is it pink? Well, I asked my daughter to go to the store to get me some emery board. Did I tell you why it's pink? Yeah. Okay. So I asked my daughter to go to the store to get me some. That's why it's pink. So you can use the stone or the emery board to clean the skin, all right? and then saline gel for conduction. But put the gel only on the electrode, on those cylinders. So just a little dab, 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 dab. Yeah, right there, dab, dab, dab. Now, these stick pretty good, but if you need to, put some tape on just to make sure it stays, maybe in areas that might have a little crease in it or something of the joint, then you might have to tape it down. But for the most part, sometimes it's kind of hard to even take off. But make sure it's down there firm. Then, go ahead and put that on. Snap it on. And then I'll go ahead and peel this off, and then go ahead and stick it to the area. Okay. Signals are displayed on an oscilloscope. And of course, yes.
The emery board. If you don't add any lubricant, is the person not going to bruise or something? Because some people have soft skin.
I know, so you just want to be real careful.
Would it be better or just as good to have warm water and a washcloth?
That won't take away the dead tissue and that little bit of that first layer of skin. So we want to make sure that any small electrical potential can come through and is not impeded by dirt or some layer of skin that's about to come off or anything. We want to get anything. Yeah? Hair. Yes. So if you need to shave, you can shave that area. Just be careful. Yes, you sure can. All right. So oscilloscope. This is where the meter. This is where everything will show on the graph. Also, audible clicks. So again, you can either hear the noise or you can see the screen. Visual and audible signals related to magnitude of muscle contraction. So as I said before, the size of the muscle contraction. Big contraction, lots of noise, high graph. Little contraction, a little bit of noise, a little bit on the graph. As it says, strong contraction, strong signal. Or weak contraction, weak signal. So let's give some examples of how we can use it. Person has hemiplegia. We're using it for muscle re-education of controlled dorsiflexion of the foot. For improved gait, maybe we have worked on some E-stem as well for the foot, and now we want to encourage the activity of the anterior tib and toe extensors for ambulation. So, and we want to, of course, discourage the activity of plantar flexion, because maybe they may have drop foot or something like that. All right, so when we put that on, we can put it on and they can hear the noise when they reach that preferred level that you have decided that they should be able to reach for that dorsiflexion so that they can do a good heel strike going through. Okay. Biofeedback, especially beneficial if other feedback sensory is deficient or is decreased. So biofeedback works very well in conditions where the body does not have its greatest function. Biofeedback works very well when the body does not have its greatest function. Biofeedback works very well when the body does not have its greatest function. So when it's really deficient, that machine can really pick up everything and give you some good insight. Okay. All right, so number 4, inhibition of spasticity from any cause. So a person may have a stroke, CVA, person may have cerebral palsy, person may have multiple sclerosis. Let's say we have a stroke patient that's walking and we want to discourage spasticity. Now, inhibition means blocking or preventing. So as they're walking, maybe when they're walking through, since they're really trying hard to bring that leg through, the spasticity kicks in. And we want them to calm down. So we might put the electrodes on the arm to discourage the spasticity so that they can really just focus on bringing that leg through and walking and not getting real excited and then doing increased spasticity. All right? Okay. Status post tendon or muscle transplant. let's say that the biceps was damaged due to a burn, an accident, or some sort of disease process. They might pull a piece of the gracilis, which is an adductor, all right, pull some of that and put that up here to act as a bicep. Now, as it's acting as a bicep, we need to get some feedback of how this thing is working. We need to reconnect some arteries and some veins to make everything move correctly. But we want to get some feedback to see how well is that gracilis that was in the leg now working in the arm to do elbow flexion. Okay. Helps to detect when voluntary effort produces contraction in desired muscle. Yes. Posture control re-education. Monitors worn on the trunk and head which signal away from vertical. So the person may be in a sitting position and they tend to slump a lot. And as they slump, beep, 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 beep. So it gives them that reminder of, don't keep doing that, don't keep doing that. As long as you're in the right position, it will be fine. Low back pain, trunk inclination, kind of similar, but the difference is the person may say, I feel a lot of pain at this point. So the machine will be set so that you'll be real careful not to go to this point and cause pain anymore. Okay? Because you may be off from remembering that. Weight-bearing control with pressure sensor under the foot. So there's something called a force guard that's placed in the shoe of a patient. And when they walk, the biofeedback is set on the machine. So if they're putting too much weight, beep, 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 beep. So it'll go off when you're doing too much. It'll go off. So force guard. So weight-bearing sensor.
Measure how much weight you're putting on it?
How much weight you're putting on. So you can register. This cannot. No. There's multiple types of biofeedback machine. All right, but we're just giving some insight, connectivity to the information. All right, so so lab technique and training session for muscle feedback. So electrodes are placed on the body. The person must see and hear that unit. They must see it. Full explanation of the purpose of the treatment and what's expected. And then you want to minimize interference from other electrodes, so depending on how big your electrodes are. So this is not the only size, just like E-stem, it's not the only size. So be real careful of other muscles around that area, so you can just focus on the one you want to focus on. Adjust the sensitivity of the unit. We'll do that tomorrow, so that if one person is a little stronger than another, then we need to show where's the baseline for a person. And then we'll see where that baseline is, and then we'll shoot from there. All right, so you have to set it for each individual person. Series of attempts by patient to increase signal. So basically, they're going to keep trying and trying and trying to increase that signal. Then you're going to encourage verbally the opposite limb contraction. So if I'm working on that bicep transplant, and I'm doing this here, and there's nothing wrong with this arm, then I can also do this arm too, and what will happen is what they call an overflow. Since you're trying so hard with one, it causes the other arm to kick in too, and try a little harder. All right, so you want to try to ask for the opposite end limb contraction. If we have increased concentration by the patient, in order to get that, we're going to need to increase the length of time. So we need to keep trying longer and longer sessions to increase that concentration by the patient. Eventually, we're going to wean that patient off of this device. Eventually, we're going to be able to see how the movement is occurring. And then we might say, okay, raise your arm up, raise your arm up. Now, you're going to have to be real good with, let's say, goniometry. So you can't say, okay, hold on for a second, hold on, give me a minute, hold on. Because see, what's happening is, this is happening over time because you're taking too long. So you need to be real good and then get it, because you want to get the activity movement with goniometry. All right, let's go next page. Now, not just muscle related, but stress related too. Okay. Treatment of stress conditions, control of autonomic nervous system. So the ANS is being looked at now. Measures electrical resistance of hands by the amount of sweating that's happening. BP can be controlled for hypertension. So we'll see the feedback. Again, not with this biofeedback machine because it does not do that. This one does not. Okay. Heart rate control for cardiac arrhythmias. So someone who really has cardiac arrhythmias, we just want to get them to slow down and relax. Okay. Vasodilatation control for someone who has idiopathic Raynaud's disease. So a person who has Raynaud's disease has blueness in the digits. All right, so we want to try to get some more circulation in those digits. Monitors monitors temperature of fingers via a skin thermometer. Muscle relaxation for migraine and tension headaches, chronic back pain. Again. All right, and then electromyograph of the occipital frontalis muscle, and that's where we can place it, posterior neck and back muscles, and we can actually monitor that migraine and tension headaches. Now, lab technique. Comfortable seated or supine position without interruption. So nice, quiet room, maybe with the lights out and the blinds open just a little bit. Okay. A thermistor is a temperature sensing element or temperature sensory element. Thermistor is attached to the middle finger. Most of the blood can really fall right there in the center of the arm, right there to that middle finger. All right, so the middle finger has a temperature sensory element called a thermistor. All right, on the dominant hand. Because most of the time you use that dominant hand, so more blood is going to be focused on that side. All right. Baseline reading taken in a few seconds. Patient instructed to close their eyes, relax, and imagine circumstances in which the hands and fingers are being warmed. Okay? Can repeat the phrases, I feel relaxed, my hands are getting warmer, whatever it takes to help them to get that temperature up. Thermometer reading every 30 seconds for feedback, and attention is drawn to any slight increase. So if you see that, then say something to them. Okay? Open eyes only when the patient can maintain relaxation. So if they can't, then they need to keep their eyes closed so that they can stay in that imagery situation. Encourage patients to watch the thermistor or the thermometer. Use imagery appropriate to the patient's experience. So, if you say, imagine that you've been in, that you're in the Bahamas, and they have never been out of Baltimore, that ain't a good experience. You know, imagine a hot day down on Pennsylvania Avenue. They might be able to think about that, but they might not be able to think about over in the Caribbean. So that's too much. So something that they can think about so that we can get that temperature to go up. 10 to 30-minute sessions. Home programs. Home programs are good. So it's just like exercise. I want to take your, I want to do a muscle grade for you. We do some exercises here. I want you to do some exercises at home. You come back and I'm going to take your muscle grade again. Okay, so same thing here. As they're home, I want them to start thinking about those situations at home, so that they can improve at home. And then we'll put the thermistor on again, and we can see if the temperatures went up. So anything that can be done at home is excellent, because we want that to be done. All right? And then wean from the unit over time. Conclusion. Electromyograph biofeedback is likely to be most effective when normal sensory and proprioceptive feedback are deficient. I said that earlier, just in a different way. Valuable adjunct. What is an adjunct? Sonia's an adjunct. Did y'all know Sonia was an adjunct? Mm-hmm. What is an adjunct? Assistant. An assistant. Okay. So, valuable adjunct for re-education for neurological conditions. All right. Good. All right. Now, That's time we're looking at the deck clock at this terrible rate. And they had an electrical issue this weekend at the school for probably Friday, Saturday, and Sunday. Then it came back on, and now the internet is down.
I have an Essex too. I got 2 texts.
Really?
Oh no, wait. Maybe it was from here. I got a text from one of my schools saying that the electric.
Yeah, so there's no internet or anything going on. So I don't know when that clock is going to be right. But let's see, we're at 11:52. All right, let's go to Ionto, and then we'll take a break. And then we need to go to pelvic traction. Ionto.
Page 1.
Go to the beginning of the book. Page 1. All right, now, we took ultrasound, and we put a medication on the body, and then we turned the ultrasound on. Phonoapheresis. So there was sound waves that was able to push in a medication transdermally, or through the skin. All right. This is iontophoresis. So we have electricity that's going to transfer a drug, in this case an ion, through the skin transdermally. All right. Locally. So we're going to focus on local. All right. So an ion is going to transfer through the skin a drug, and it's going to go through the skin via or by way of an electrical current. So we're going to send an electrical current through and send this drug into the body for treatment. Now, what should the person feel? A mild tingling. So unlike regular E-stim, where it should be strong, sensory, yes, but a mild tingling. Okay. If they have, yes.
Is electricity which is the ion?
Electricity is transferring an ion. So you have medication on you. Put the patch on. And it pushes through your skin that medicine. The electricity.
The ion is the one.
The ion is the medicine. The ion is the drug.
Okay.
The electricity is sending the drug into the body. Yes. So they should feel a mild tingling or prickling or whatever. They should not feel a mild irritation. We should not get that, or itching or something like that. Now, with Ionto, it is energy by conduction. Conduction. All right, so energy by conduction. All right, now, an ion has a positive or a negative charge, which is very important to know. All right, so a positive or a negative charge. Positive or a negative charge. All right, you all remember? Anybody remember NBC? Mm-hmm. Negative. Black cathode. RAP or RAP. Red. Anode. Positive. You really want to know about this. Okay, so we need to know if it's a negatively charged ion drug or if it's a positively charged ion drug. How do we find that out? Either from a pharmacist, or we have to look in some medical literature, or we have to go back to chemistry and look at the periodic table. Now remember the periodic table of elements? You have to go back and look at that. All right. You will need a doctor's referral because it is a drug. So it will be a referral from a doctor. All right, so number 1 says, active transdermal, going through the skin, drug delivery system. Uses, in this case, is going to use a, and you can just write this in, a or a low volt DC current. Low volt DC current.
You did this first.
Low volt, yeah, not the norm. Yeah. Purpose is to reduce soft tissue inflammation, acute or subacute. Now, it says, alternative to oral meds and more effective. Why do you think iontophoresis, if I'm treating, let's say, lateral epicondylitis, is more effective than oral meds? At the site. Because oral meds, I'm hoping they go to the elbow. You know, I'm hoping they, find this way. I'm still in awe as to how it go down anyway, so I'm hoping it does. So, more effective. All right. Alternative to injectables, but less effective. All right. Less effective. Why is it less effective? Because injectable goes right there to that vein artery, right there to that spot. However, it's non-invasive. All right. So if it's non-invasive, what does that also mean? It's safe, and it can't transfer bacteria. All right, so we don't want to transfer bacteria to that area. Here's a good thing too. It stays local. So if I put the patch on the elbow, I'm going to stay local. As opposed to, I take oral medication, I don't know where it's going to fall off in my body. Okay. All right, so it stays local. All right, here we go. Designed to be used with adjunct assistance, okay, of mild, underline the word mild therapeutic exercise only. We'll get to that in a second. No ultrasound before or after. No hydrotherapy. Okay, so why mild exercise? Mild exercise. After I put it on, I want to do mild exercise. Why mild? Because this kind of exercise is going to do what? Get rid of it. It's going to pump it away. All right, so we don't want to do that because we're going to increase it and push it away. We don't want to do that. No ultrasound before or after because the deep heating will push it away. All right. No hydrotherapy because same thing. It's going to push it away. You can even add to that. No hot pack because it's going to push it away. All right. So we don't want to do that. And keep it in that area.
Anything that will increase circulation.
Anything that's going to increase circulation, stay away from it. But mild exercise because we need to make sure that movement occurs, but not enough that's going to cause it to move. Need intact skin. Do not shave. Let me add to that. Do not use an emery board. Let me add to that. Don't use, what else? A pumice stone. Good. Why? Because now we're exposing the skin to a medication that if the skin really gets open to that medication, it's really going to be burning. All right? Whereas with what we just did before on biofeedback, we do want that because the surface electrodes we want to pick up as much as possible. So please don't get those two confused. Hint. Hint. Okay. All right. Okay. Now, research protocols says that every other day for about 4 to 6 sessions is best. Now, dexamethasone, sodium phosphate, is a potent corticosteroid, and it is a negative ion. Hold on to that. All right, negative ion. So that drug is a negative ion. Okay. It's for anti-inflammatory effect. It penetrates about 1.7 centimeters. Lidocaine hydrochloride is for anesthesia, for pain relief. It has a positive charge. Important to know. penetrates up to 6 millimeters. All right. Now, I'm going to write this down somewhere. An electrode with the same charge drives the drug into the skin via electrorepulsion. An electrode with the same charge or the same polarity drives the drug into the skin via electrorepulsion. So, if I hook this electrode up to the drug electrode, that is dexamethasone. This is negative. Yes? Black. Okay. I hook the black electrode to the lead, and then, hook the lead of the black electrode to the patient with the dexamethasone. When the two charges come together, they repulse. Okay, so stand up for a second.
Just like with magnets, right?
Just like with magnets. So let's say that this is the area of treatment. Okay, this is the area I want to treat. And you stand right there. All right. So soon as the electricity comes, it's always like, ew! And it pushes the drug into the body. It pushes away and they separate. When they separate, the electricity bounces back one way, the drug goes the other way. All right? But it has to be like charges. Same charges. Like charges repel. Like charges repel. Like charges repel. All right, equipment. I need a phoreser. It's a phoreser. This is the phoreser.
Does it need always to be like charges repel?
Yeah, because the same charges won't.
That's right.
So it has to, the same charges will, different charges will attract, like man and woman. In some cases, not all cases. Yeah, all right. So, phoreser, a generator of low volt DC current. So what you want to do is dial in, put in the parameters, in milliamp minutes. And it says 10 minutes times 4 milliamps. I'm not going to go there right now. We'll talk about how we do that in a second. Electrodes. You want to have one active electrode, and it says dehydrated polymer gel. Doesn't necessarily have to be a gel. It could be. Medication must be added. We'll see it all in the video, so we'll find out in a second. Added, and it takes about 1.5 to 5 minutes. So after I put that medication onto that electrode, it takes about that much time for that electrode to get soaked. All right. Dispersive, hypoallergenic, cara with carbon pad does not have to be 2 times the size of the active electrode. Why is that the case? All right, let's see. So here is here's the dispersive electrode. Okay. Here is the active electrode. Now, one reason is because the actual metal element inside of here is way smaller than the actual pad itself. All right, so we just want to have that metal element right over top of that, and this will be the active. We'll add the medication to this one, all right, and then use this as a dispersive so that we can have a circuit of electricity. All right. If I'm using dexamethasone, I need to put the black lead on here. If I'm using lidocaine, I need to put the red lead on here. Okay, because like charges repel. So, they repel. So like charges repel. Okay. Now, so technique. Skin preparation. Cleaning is most important. Need to decrease impedance of the striatum corneum. Remove the dead skin cells, body oils, foreign matter, anything that's on there with alcohol. Decrease the resistance to the current to assist in take-up of ions or that drug. More comfortable. Burns may result if not cleansed well or cleansed improperly. So if we're scraping and shaving or whatever, then we'll have some problems. Where we could with biofeedback, but we don't want to do that with
The
ion.
only thing that we should do is the alcohol.
Alcohol, very good, and that's about it. You can use scissors to cut the hair, but you cannot use a blade to scrape the skin. So do as much as you can to get the hair as low as possible, but no, as it says here, trim excess hair with scissors, never shave.